Hi, good morning. So right now I'm here to perform an incentive spirometer. So I'm going to explain everything, and then later on I will let myself assume be the patient to do and perform the incentive spirometer. So first and foremost, every time we go to the patient's room, we always check the patient's chart, and then we always make sure that we got the correct physician's order in letting this perform to the patient. And then we always make sure we have this device up with us at all times. When going inside the patient's room, we will introduce ourselves to the patient, and then we will explain to them what's the purpose of this one. So this one is incentive spirometer. So this one will help aid in their, it will open up, expand their lungs, and at the same time it will also help remove secretions if they've got secretions present in their lungs. So I will wash my hands, and then after that I will grab this device with me. So in here, assuming I am the patient, make sure that we always check the device if there are no cracks, especially in here, especially it might fall down. And then once we're ready, we will check the estimate pressure or the maximum capacity, especially if I am male. So I'm gonna set myself with my age and with my height at about 2000, almost 2000, because it's here about, yes, 2000. And then I'm going to insert this one, and then if I am the patient, especially we go to the patient's room, we either let the patient sit in an upright position. If they're incapable to do that one, we can either position the head and adjust it until we're going to position them like a upright position. And then once we do this one, first is we make sure that we always have this goal, especially for myself, my estimate volume in here, which is 2000. So first is make sure we always what they call this, we always exhale until we feel our lungs are empty. And then once we feel our lungs are empty, we put this one in our mouthpiece, and then make sure that there's a tight seal. And then we will take a slow deep inspiration, and then once we take a slow deep inspiration, we hold our breath until we notice this one, the white thing, the piston would drop, and remove the device and exhale normally. So we're going to see, I'm going to exhale until my lungs are empty. Put it inside the mouth. Then if I am still capable, I can perform another one. Like still the same thing, exhale all air out. Then put inside the mouth. So with this one, we can perform this to the patient about almost 10 times per hour, especially, and then it is indicated only for patients who are awake and conscious and cooperative. And then another thing with this one is that whenever we did this, we always make sure we're gonna document everything, especially for the initial trials. If what pressure or volume did the patient meet, like me, I got 2000. And then with later in the next hour, we can also input another data. And then another important information with this one is that if there are some patients who've got surgery in their chest or stomach, while performing this one, we can either put a pillow in front of them while performing, so that it will prevent any complications or pain. And then once we also perform this one, we always make sure that when taking up the other vital signs, one of the important things in performing incentive spirometry is that we always make sure we let the patient cough every time they do this after. And then we always make sure that we also do auscultation every and after performing this one. And then once we're done with this, we always put it on the side and then make sure it's covered. And then with the mouthpiece, we will just let it cover it with a clean tissue, and then make sure that you're going to put it in a safe place so that it will not fall down or cracks. And then once we're done, we always have to obtain